It's your girl Paige, your master cosmetologist and wax expert.
And I'm Taylor, doctor of nursing practice. I'm a family nurse practitioner, and my special interest is PCOS and aesthetics.
All right. Hey, Taylor.
Hey.
Nice meeting you again.
All right.
Okay, so really, this podcast is going to be about just integrating health, wellness, and just all the things for women and men. We're going to be inclusive.
A little bit.
Just a little bit, though.
So, as a FNP, I found my little special interest in PCOS. So anytime someone comes in with those symptoms, I'm ready to jump on it. And some other hormonal issues, but mostly PCOS.
And as a, specialized waxer, I have a lot of clients that suffer from PCOS, and they come in and get waxed often. So this will be a great opportunity to just go over some things that you all might not know and the ways that you can take care of it.
So for this episode, we're just going to start off with like our background, experience, why we started the podcast, get a little more into that, and, tell y'all what you can expect in the future. And then later on, we'll do a little fun segment, little trivia between the two of us.
Yay!
So, Paige, tell me about your background.
Okay, well, I am a cosmetologist. I used to do hair, and I did hair for a really long time. And it wasn't until COVID that I decided to just start something new. And then I got into waxing, and I opened up my own business. And at Stacks Wax, come get waxed. And yeah, I've been doing that for about like 3-4 years now. So very, very into the beauty world with me. What about you, Taylor?
Well, I'm a nurse girl.
She also has her esthetician license.
Yeah, I love to collect a certificate, a degree, or whatever. So I've been a nurse for 10 years. I did 5 years of school to get my doctorate, and then I have a year of experience as an FNP. And
it's my nurse, y'all.
I also recently kind of started my own side practice, mostly for aesthetics and women's health.
Yeah, where are you located? Let them know.
I'm in Silver Spring. Yes, then when I do my regular primary care, I'm in Germantown.
Okay, great. All right, so let's dive into, why we're here today. PCOS and waxing. They go hand in hand.
And do. So, I guess PCOS was like the big part because I'm assuming as a waxer you see a lot of the girls coming in to get, maybe their chin waxed or, they have a little bit more
sideburns.
Yeah.
And lip.
Things like that. So that was like the origin of this. So do we want to just jump into like what PCOS is in the first place?
Yeah. Let them know.
Okay. So PCOS is a syndrome, polycystic ovarian syndrome. And syndromes, anytime, is just a collection of symptoms. So for PCOS, you have to have hyperandrogenism, which is basically high testosterone. Ovulatory dysfunction, which it might be like your periods might be completely missing, or like they come every now and then whenever they want to come. Like basically you might just not have one monthly. And then polycystic ovaries, which you can see on ultrasound. So according to the Rotterdam criteria, which I kind of go off of, you have to have 2 out of the 3. So you don't even necessarily have to have high testosterone. You can have dysfunction with your ovaries, and then you can also have a bunch of cysts in your ovaries. Like 2 out of 3, you are PCOS. And then when you get into the high testosterone, that's when a lot of people see like the increase in hair growth, or you might have some hair growth where you typically wouldn't see it for females. And then, of course, if your testosterone's high, sometimes that can mess with your periods too. So that's where you also get in with, your period's missing or it's being weird. And then my brain just turned off.
It's okay, Pastor.
Anyways, a lot of patients also see insulin resistance. So that's something that we try to correct, because it's thought that with insulin resistance, it causes your ovaries to release more testosterone, or to like help create more testosterone, which just adds on to the other problem. So the more insulin resistance you are, the higher testosterone is. And then there you go. And then the polycystic ovaries, basically that's how you ovulate, but you just keep going in a circle, and you're not ovulating. And that's also why you're not having a period. So that's that collection of symptoms. And everybody basically is like at their wit's end by the time I see them, which understandable.
That's pretty deep. That's a lot to take in.
Yeah. And what kills me is that the first line medication for it is just birth control. Which, I mean, for women, that's always the first line. Anything. Oh, just slap some birth control on it. I don't give people birth control unless they're trying to control birth. So there's that.
And that goes into like a question. Do you think that birth control can make the hair growth even more worse, like on your face?
Not typically. No.
Okay. Because I don't know. I feel like I've heard like a lot of side effects coming from birth control, like weight gain, acne.
Per studies, which I mean, I guess you also have to think like, who did they do the study on? Because a lot of them, exclude Black women, people of color. So you have to think about that first. But it's thought that birth control be making you gain weight, but it's like 2 pounds. It's not 20.
And so, in regards to just like taking care of those symptoms with waxing, I know I see a lot of women who come in and they'll have like a lot of hair, like beard wise. It'll be like a really thick beard up to their sideburns. And then there's some that aren't as dense. Is there a difference in hair texture that they should look out for if they haven't been diagnosed?
I would say, so if you notice like, okay, I have a beard, I have to basically shave it or wax it often, then yeah, I'd probably say, go see your PCP. Versus like, you might have a few hairs, here and there. That's normal. But if you're finding that you have to actually have a routine for it where it shouldn't be growing, then yeah, go see your PCP. But then, I mean, you also have to take into consideration, like, some people are just more hairy. Look at your genetics. Is your mom super hairy? Is your dad super hairy? You might just be a little more hairy. So, I mean, but you also just won't know until you go and, get it worked up. And there's no harm in doing that neither.
What are some of the questions that they should, like, present to their doctors if they are curious to get tested? Or what if their doctor's like, I don't think so. Like, should they find another second opinion or, like, just leave it be?
If your doctor says, I don't know, and won't even work you up, come see me.
Yes, come see the queen, Dr. Taylor. Yes.
I mean, all you got to do is listen to your patient. But you should know, like, this pattern of hair growth is not normal. And I say that in quotes for females. And also, why are you missing your period? If I come in and I'm like, I'm missing my period, okay, let's do a pregnancy test. Obviously. Okay, not pregnant. Where is your period? That's not normal. So now we should be doing a workup. And then, honestly, to look for polycystic ovaries, it's an ultrasound. It's not, like, the workup for this is not deep. So I don't even understand why
doctors be acting like it's deep though. Like they don't want to give you an ultrasound. But like I don't know.
I don't know either. I don't got nothing for you.
Yeah.
It's weird to me.
So as far as like you hit on the line of hormonal imbalances and stuff like that, does having like hormonal imbalances, because I can't, as a cosmetologist, I can't diagnose anyone with anything. I can just suggest that they go see a doctor. But I can say that like certain medications or topical things that you put on your face can make your skin more sensitive, which can also make it a little bit more riskier to get waxed. Are there any like topical medications or even like the ones like pills or anything that people who are suffering from PCOS should be aware of if they go through with waxing?
If they're only using like the medications mostly for PCOS, typically no. Like I put a lot of people on metformin to help with insulin resistance. That doesn't increase skin sensitivity, or like you won't be ripping off their skin when you're waxing them. And then another one is inositol. That's just a supplement, not even like a medication. That doesn't do that either. And then a lot of patients want to try the GLP ones, like the Ozempic and Mounjaro, which the ones really for weight loss. Anyways, the ones for weight loss are actually Wegovy and Zepbound, but everybody knows it as their original one. And that doesn't increase like skin sensitivity or anything like that. So it's not like when people be coming in and be like using retinol and then don't tell you, and now you holding like a strip of skin in your hand. So no.
Okay, so I think like you hit on that. If it doesn't necessarily will affect their treatment, like if they want to do laser or waxing.
No.
Okay. Do you like think that lasering is kind of a better option? I do have clients who have moved on to lasering, and they, there's some promising results. But like, what are your thoughts on lasering?
Well, first of all, they got money.
Mm-hmm.
Second of all,
yes, queens with the laser money.
Lasering is a good option. I don't know too much about lasering. Never used it. But as far as I know, the YAG laser is I think the top choice for women of color. But I think with lasering, the big thing is like the contrast between your hair and your skin, so that the laser can like pinpoint it. I think that's where people be running into trouble.
I will say too, like whatever option that you decide to do to treat your symptoms, just make sure that your skin is in the best and healthy condition. And to prevent like ingrowns or anything like that from waxing, just exfoliating and keeping your skin moisturized. And then also getting on a routine with your waxing. I think that's probably the best.
True.
Tea.
Because one thing about it, I don't like a routine. It just be chaos.
Yes, and I be having clients that I haven't seen in weeks with full beards.
Okay. I'm the client.
And it's very stressful because sometimes when they shave, it just makes it worse.
That's true. And then that's
shaving. I do not promote shaving. Yeah, do not shave. I would if you're gonna remove your hair, wax, and if you don't want to pay to get waxed, do it yourself. But I wouldn't suggest that either because you might burn yourself. But shaving is terrible.
Yeah, I mean sometimes you might just have to pop out and show the girls.
If you gotta pop out and it's an emergency, sure. But other than that, don't shave yourself.
But I do like about waxing too is like you also get a little exfoliation there.
Yeah.
And one thing that I recently have started doing, I will slap a chemical peel on anything. So that helps get up them ingrown hairs, exfoliate, anything. If I have a little pimple,
Hyperpigmentation.
yes. If I have a pimple, I just put a little dab of my chemical peel on there, gone by the morning.
And you offer these services at your new studio?
And do. And do.
Yeah, we'll get into chemical peels one day soon.
Yeah.
Yeah, that's a deep one. But they're really good for correcting your skin if you have any issues. And like as far as like lifestyle, dietary influences, I know like that's like a big thing. Just eating more healthier can kind of like alleviate a lot of issues, health issues. Is there any like recommendations that you can advise our listeners as far as what they should do for their skin and hair?
Well,
Or is like losing weight, managing your weight a big one? Because sometimes, like, I feel like I hear that losing weight with PCOS is also kind of challenging.
well, yes. Because if you're an insulin resistant PCOS haver, it's going to be hard. But did you not get the memo that if you don't fit into the normal BMI box, then everything is because you're fat. Stop eating so much. Stop and just lose weight, and then everything in your life will be just fine. That's it. That's all. Just calories in and then calories out.
Yeah, that's really stressful.
No, that was sarcastic. That's not how it works.
Yeah, I know, but like that's what the doctors be telling you.
Oh, yeah.
Yeah,
And do.
they just be like, "Girl, lose some weight."
First of all, BMI is based on white men, so let's start there.
A white man.
So it just don't be adding up. I like to move towards like waist circumference, but even then I'm like, some of these things just aren't always weight is the end all be all. I forgot what question you even asked. Dietary influences.
Yeah, like is there like I mean, you're not a nutritionist, but is losing weight and just like eating healthy like a good start to kind of managing PCOS?
Losing weight does help with insulin resistance, but it's easier said than done is the point. Like sometimes you just need help and that's fine instead of, people looking at you like you're not trying. Like some people have come in and they be in the gym all day long and eating like really healthy and can't lose the weight because they just cannot. So it's not fair for you to just tell them do that when they already been doing it.
Will medication though like help with that though?
Okay, so metformin, the one that helps with insulin resistance, that should help you like lose weight a little easier if you're increasing your insulin sensitivity. But because a lot of people with PCOS already run into this problem, the GLPs, Ozempic, Mounjaro, Wegovy, Zepbound help a lot because it decreases your appetite and it slows your gastric emptying so you feel fuller longer. It's also thought that if you do lose a little weight, it is easier to manage the PCOS symptoms. But it's not like, you got to get all the way down to a quote unquote normal BMI. You just have to lose a little weight.
Right. So just managing just being healthy overall. Just an overall healthy lifestyle. Like walking, like doing things that aren't like reducing your stress level.
Yes, stress is a big one too. Stress will not allow you to lose weight. It just won't. It's a op.
Stress is an op. Hey yo, fuck stress. Yo, fuck stress, man. That shit will kill you. Stress will fucking kill you. Like, okay, yeah. But on to stress being an op, not being able to like manage your or like lose weight and like, you got hair on your face. That comes with a lot of like, you know, body dysmorphia, body hate, you know, you're
Yeah.
not happy with yourself.
Yeah. Um, Definitely like some mental health issues stem from it too. And not only like the symptoms that you have to deal with on a daily basis, but it's also the fact that you can go to so many doctors or providers, whatever, and they just don't listen to you, or they just give you birth control, which is not fixing or helping any of the underlying issues.
Right. And it also, like, I do get clients who, I mean, we joke in the studio a lot, but like, waxing our mustaches and stuff like that. But it's like, I don't know. We joke about, oh, I'm a man. Like, I feel like a man. This shit makes me, less feminine, which I think does play a role too in like how you feel about being like a woman as a whole. Because I mean, I'm assuming like we don't want to walk around with like a beard on our face. So like it's a tough thing to like be dealing with.
I agree. I don't even know if I have really much more to say. I mean, it's tough. I mean, because everybody's gonna look at you, they're gonna talk about you, they're gonna drag
And
you,
you just tell them
whatever.
go to hell.
I mean, that part.
You just say fuck you, and you live your life, and you do what you gotta do to make yourself feel good. So if that's waxing, lasering, God forbid, if you gotta shave, that's only if you gotta pop out, like we said. But like do what you gotta do. PCOS isn't like the worst thing. It's manageable if you do the right things.
Yeah, and I mean, it's definitely not like a one size fits all type of thing. And you also have to think like, okay, what well, this is me as a nurse practitioner. What does my patient want? Do they want birth control? If they want it, then sure, let's do it. But, or do they not want metformin, which is like a medication? Do they just want to start with inositol, which is a supplement and thought of as like, more natural? So there's that part too.
Yeah. But we just want to tell y'all, like, the main thing is having confidence within yourself. Like, if you're going through this, get help.
Yeah. And I mean, if something doesn't work, try something else.
Try something else. Ask questions. Don't be afraid to, like, get second opinions, too. Because sometimes, like,
Third,
you
fourth,
know,
fifth.
yeah, and just, you know, find that right doctor, like Dr. Taylor. Dr. Taylor, my girl, my
Anyhow,
doctor.
I do say like up front, it can be a lot of trial and error. And, some people appreciate that, like knowing that, maybe this won't work, but, that there's someone willing to work through it with you. So,
That was good.
um, I want to start like a PCOS group where, you can like share tips or, I would also be in the group. So if you have like questions that, you would want like a professional to answer, I can, lend some expertise on that. But it's just kind of like a safe space to just be amongst people that, have the same struggle, same syndrome as you.
Yeah, and I can refer my clients to said group.
Yeah. It'll be like really informal. Like, let's not get too crazy.
Let's not get too crazy. But being comfortable with being able to ask your questions. 'Cause sometimes, like, um, people probably don't even know that they have PCOS, and they're just like, why do I have this hair on my face?
Yeah. But I mean, some people don't have hair on their face.
Oh, that too. We didn't touch on that one.
Yeah. Your period's missing.
Oh, yeah, we did
People
touch
will
on
tell
that
you to
earlier. You said
lose weight
something.
for that too. Like, it's things that deserve investigation at least.
Right. And we're some FBI agents. We're going to get down to the bottom of it.
Yeah. Yeah, and will.
And will. So I here you got some questions for me. You got some questions for me.
Oh my goodness. Okay. I want to start with some fun ones and then maybe we can do some serious ones. Wait, for trivia or just for questions? Actually, no, I do got some questions
She's
for
about to
you.
embarrass me.
Um, when people come in for you, what waxing techniques do you like to use for our PCOSers?
Oh, for face wax, it varies. And I think we hit on this topic earlier. Like the density of the hair makes a huge difference on what type of wax I like to use. So, um, I'm usually a big heart waxer. If you don't know what that is, it's just the wax that you don't have to use a strip. That's really good for sensitive skin. Um, but for people who have a little bit more hair, um, I tend to use both methods of the hard wax and the strip. I feel like the strip kind of gets more of those little tiny hairs out, and gives a smoother finish.
The strip?
Mhm.
Mm-hmm.
But I like to use that as like the second go round.
Interesting. Because even though I technically have been trained on waxing, I don't have the patience. Definitely don't have the patience for hard wax. So there's that.
Soft wax is faster. You can get it done faster. It's a little bit more painful.
That
So
part.
yeah.
But yeah, definitely hard wax is if I get it wrong the first time, that's it. I'm knocking everything over. I'm leaving.
Um. Okay. You have another one for me, or
Well, I guess we kind of already talked about it, like the advice that you would give clients for maintaining like skin health in between waxing sessions, but you said be consistent. Are there any products that you like tell people to get?
um. I mean, you can probably vouch for this. I am a big fan for acids.
Okay.
Exfoliating acids, I just think work best, and faster. I think they penetrate the skin a little bit better than physical. And sometimes those physical exfoliants be like fucking up y'all skin.
Yeah, because you're creating like possibly micro tears,
Yeah.
and then
And that can cause a whole lot of trouble
because
and
we
dark spots and scars.
yeah, and we know that y'all be getting a fresh wax and going to get in the pool or be having sex that same night. So just then you're gonna add some micro tears in there.
It's a lot of bacteria being transferred, man.
Yeah.
You gotta be careful with physical exfoliants. If you're gonna do one, I would I would go for like a glove than a scrub. But if you do a scrub, I like salt scrubs better than sugar scrubs.
Okay.
Salt like cleanses the skin a little bit better than the sugar.
Okay.
And then sometimes that sugar be giving like some yeast. Be getting that
True.
yeast infection up in there.
Because that's what the yeast live off of.
Sugar.
That's why the
Hey
diabetics
yo,
be having
fuck
a lot of
sugar.
yeast.
Sugar is evil too. Like fuck sugar.
And in America, they put that shit on
Yeah.
everything.
Yeah.
They're absolutely trying to kill us over here.
Yeah, so I'm a big fan of acids, glycolic acid, salicylic acid, mandelic acid, kojic acid.
Yes, kojic acid. I be trying to keep an eye out for that one because it does what needs to be done.
Those, but you have to do it with proper like routine and care, like because that will also burn your face off.
Yes, and it's very difficult for me, I think, sometimes to really think about like how often should this person be doing this because I have normal skin. So I just be doing whatever and it's fine. But someone else would do that and their face will melt off and now they want to fight me. So
Yeah, you gotta wear your sunscreen. You gotta and use the
yes,
right products. So that's something that you can educate them on.
please wear your
Taylor is
sunscreen.
gonna be like deep into the facials. I'm not really into facials like that, but
Yeah,
waxing aftercare, I can tell you what's good.
I've leaned a little bit more into like medical spa type things. So like dermaplaning, chemical peels, microneedling. But I do have a soft spot for acne. So I want to start putting together like a very nice protocol for that. But there's one, I feel like we got really off topic. But anyways, there's one product from Society that I've been using. It's the oxygen treatment kit or whatever it is. Basically, you put on um, the base, like, I don't know, the cream or whatever, and then you put on the catalyst, and it warms up your face a little bit, but it helps infuse oxygen into your skin, and it really helps with cleaning up your skin. So that's really important for people with acne.
Does that use like an oxygen injector? Because I think I have tried that before.
No, it's just topical. There's no like equipment used. So people see like clear, brighter skin literally right after. So I really like it.
Okay. And that's going to be a service you're going to offer?
Well, yes. Okay, so now it's time for a little fun.
Woo!
We're gonna do a little trivia. So I'm gonna ask Paige like health related questions. Some of them are really general, and then I'll scroll and see some of my options about a little more specific stuff. And then she's gonna ask me about waxing, which I should technically know, but child, I deleted that out of my head because I don't wax. So here we go. What is the recommended amount of sleep for adults?
Taylor has the answers up, so I'm cheat. But if I didn't see the answer, I would say 8. Isn't it 8 hours a night?
It is, but how many of us are really getting 8 hours?
Not me. Not me.
But fun fact, sleep also affects weight loss too. But I mean, we're fighting for our lives in the US, so what can you do, really? All right, next question. What vitamin is primarily obtained from the sun?
That D. Big D.
All right, cut the cameras. Ooh, okay. How many minutes of moderate exercise per week is the recommendation?
I know they say like at least 30 or 40 per day, per week.
Mm-hmm. So, are you gonna do the math or?
Absolutely not. Per week. Girl, I don't fucking know.
It's 150 minutes, but
100.
yes, basically. What hormone is the stress hormone?
Ooh, I feel like I should know this one.
Oh, I moved it so you can't see the answer.
Oh, what is the stress hormone? I know this one. I don't know. I need help. I know what it is, but then I don't. It's not coming to my head.
It starts with a C.
Cortisol.
Look at you.
Hey, I'm a nurse.
Okay. What else do I want to ask? True or false? PCOS only affects females who are overweight.
False. There's some skinny joints with that.
Correct. And let's see. Let me see one more. What is the hormone that regulates blood sugar levels?
Is it insulin?
Yes.
Yes.
You are a nurse. Look at
I'm
you.
a nurse.
You just go take the NCLEX tomorrow.
And I would pass because I stay on Google Health searching diseases.
Anywho. All right, that's it.
So
you did a good job.
Thank you. Thank you
you.
so much. I have some questions, and this is going to be like state board questions with waxing.
Well, okay.
Well, not Milady. You remember Milady?
Girl, I took my state board 6 years ago.
Okay, well, you should know some of these.
Well, now I'm scared. They're gonna know I'm dumb.
Okay, which direction do you wax in?
You you lay the wax in the direction that the hair grows, and then you remove it the opposite way.
Correct. But what's an exception? What form of like hair removal is an exception to?
Don't we change it for underarms?
No. A type of hair removal. It's kind of new, kind of popular.
Hair
If you don't
removal.
wax, some people do this.
Sugar? Isn't that still wax though? Kind of.
No, girl, it's sugar paste.
Same thing.
With sugaring, you rip the opposite way.
So with the green.
Yeah.
Hmm.
I think. Yeah. You
So
apply it.
don't ask me in.
No, because it's like the technique that they use is a little bit different.
Never experienced that.
Well, I could be lying. Yeah.
Anyways.
No, sugaring is definitely is applied different than wax. I know that for a fact. I don't like sugaring. Okay, so the other question.
It's a lot of questions.
How soon should someone have sex or exfoliate after getting waxed?
They should wait 24 hours.
Okay, great. I tell my clients 48 for exfoliating, 24 for sex. But you really should be waiting like 48 for sex too. Like, you can go 2 days without having sex.
To you.
Okay, yeah, to me. What's another question? Okay, another question I have is what do you do if, well, what is the ingredient, well, what do you use to remove wax with post wax? Like what is,
Off of the person?
yeah, off the person.
Oil?
Yes,
Okay.
girl, oil.
Why are we using, why is there wax left?
Because sometimes it leaves like a sticky residue or like you got some pieces
Oh, okay.
that are still on the skin just to do a little waxy. And then another question that I have is, can you get waxed on your cycle?
Yeah.
Yeah.
Apparently it's allegedly hurts a little more, but you can.
Yeah, I wax people on their cycle. You just have to have a tip on it.
Yeah. And then you just took it up right in your right in your butt crack.
And then another question. This will be my last one. Is double dipping allowed? Double dipping as a waxer.
Oh, see, this is issue because nobody can see my face. Double dipping to jail immediately. Double dipping?
Double dipping.
Absolutely not.
If you see your waxer put their stick in that pot 2 times, call the police.
Crash out right there. Double dipping? It's making me itch.
Double dipping is the most disgusting thing that they could ever do. So you guys gotta be careful with them. Those, yeah. I'm gonna stop what I was gonna say.
Exactly. All right.
Well, this was great. This was a great little first welcome back reunion. You guys didn't know me and Taylor had a podcast years ago in college.
Were podcasts like a thing?
No, we started it.
Anyways.
We were the original podcasters in 2012. Yeah, it was like sometime like that.
I don't know. It might have been earlier because that video was in the towers. So it might have even been 2011. I don't know.
Maybe it was 2011. But yeah. We back. We bike. Bike.
All right.
But yeah, this is Wax and Wellness. We should do these on Wednesday, so it'll be Wednesday Wax Wellness.
And then can we do our next one on camera and we wear pink on Wednesdays? Just
No.
kidding. All right. So for our next one, we might have some guests and we'll go into in depth about some different things. But this was the PCOS episode.
And if any of you all have questions regarding waxing, you can always follow me on Stacks Wax at Instagram and DM or email, or you can hit Taylor up.
That too.
Y'all should come to Taylor if you got, need a new,
PCP.
PCP.
Yeah.
She listens. She's a black lady that listens.
Wow, that really warmed my heart. Which, I mean, everybody really should just do that, but here we are. And then my handle is carmi.wellness on Instagram.
Yeah. Mine is Stacks Wax with the X. It's really kind of ratchet, but it's STAXKZ Wax.
All that matters is the results and the no double dipping.
Yeah.
All right, let's wrap it up.
Let me do my 2-step on out. Let me do my chicken head. Cue the music.
Bring out the dancing lobsters.
Okay, bye.
Bye.